Waking up from a nightmare with a racing heart, unable to fall asleep after a nightmare, struggling to break free from the loop of trauma and nightmares. I've been through all of this and I'm sure you have as well. Can nightmares have a purpose? If you are struggling with them, I can hear your inner voice wondering about what better purpose they might serve. Stay with me through this entire conversation to get the answers. This conversation took me from a space of thinking that my nightmares were terrible into the realm of how my nightmares might have supported my trauma healing journey. I know that by the end of this dialogue, you too will be happy that you took the time to listen. In today's podcast, we will answer 3 questions. The first is, can nightmares have a purpose in helping us? If we are shaken awake by a nightmare, what must we do to restore? What is a beautiful method of visualization that can help us work through trauma and nightmares? I could not think of anyone better than Dr. Leslie Ellis. She is a clinical psychologist whose dissertation on using focused-oriented therapy to treat PTSD for refugees with recurrent nightmares won her the Ernest Hartmann Award from the International Association for the Study of Dreams. She is the author of A Clinician's Guide to Dream Therapy, and she is a vice president of the International Association for the Study of Dreams. Let's get started. Hey everyone, I'm Deepa, a light functional medicine practitioner, author and yogini, and you're listening to the Sleep Whisperer podcast, the only sleep podcast with conversations and meditations. I'm on a mission to share profoundly insightful sleep conversations with global visionaries that merge together functional medicine and ancient wisdom. Breathe in bliss through weekly guided meditations and let yourself enter the land of dreams. Together, let's unravel the pieces, get to the roots, and understand the right tools to transform your sleep completely. Through this podcast, I want you to dream the best version of yourself. It's time to regain hope and begin your sleep journey. Pleasure to have you speaking with us today, Dr. Ellis, and I think this is something we've never discussed before on the show when we're talking about PTSD, nightmares and sleep, and particularly my interest would lie where that intersection of trauma interplays with future nightmares and how people get stuck into that vicious cycle of not being able to move past that. First of all, when I heard that you are in clinical practice, that itself had me pleasantly surprised, because I think one would imagine that this is a space which really needs a lot more people, because there's so many people where the nightmares or even their dreams could be the root of understanding so much about their personality, about how to support them in recovery, physiologically, psychologically. There's so much over there. So I just want to take a moment to appreciate you for your work, because it's so important in the world that we live in today. What actually prompted this path? What brought you into the fascination of the dream space, and what triggered your interest in actually making this a profession in terms of clinical practice?
Well, my first career was a journalist. And so I was already very much interested in talking to people and getting their stories. And I've always been extremely curious. And then I think about 10 years into that, and it was a really good career. I really, I really enjoyed it, but I found myself getting into more depth and wanting to get into more depth than really the journalistic approach would allow. And so I went and studied counseling, first in my master's and then in my doctorate. And the program I chose for my master's was at Pacifica Graduate Institute. So it's a Jungian oriented program where we learned how to work with dreams and to really appreciate depth. And I think one of the first times I witnessed somebody working with a dream in that program, I was just so in awe of the process. And then we did a lot of our own dream work. And so as part of my clinical training, I didn't realize it's not typical so much these days to learn about how to work with dreams and this whole imaginal realm. So I, really started by being trained that way and being so moved by my own dream work, by dream work with clients, by work that I'd witnessed in my program. And so I couldn't imagine practicing in a way without dream work. And I only have discovered when I got out into, I guess, more of the mainstream clinical practice and working in clinics and working in my own practice, that it's not really so much taught anymore, that it's really more of a fringe element, or people that are focusing on Jungian psychology or analytical psychology they will learn about dreams, but the vast majority of clinicians don't. And so mostly my mission these days is to teach them how to work with dreams if they didn't get that training. So I've been a clinician for 20 years, and I've really just had my most amazing sessions and biggest sort of breakthroughs with dreams, with dream work. And so I want to share that because I think, to pick up on what you were saying, that dreams are really an important window into what's going on at a deeper level for us. And if we can tap into that and understand it, we can learn things about ourselves at a much deeper level and more quickly. And our dreams, I think they're trying to do this for us, even our nightmares. I know that nightmares are not always the most pleasant dreams, but they have important things to teach us and to help us move through.
On that note, Leslie, do you feel that this is an area that could be potentially concerning if someone, there's a lot of how do I put it, in the dream world, you hear a lot, and then people talk about looking up interpretations, and these are not perhaps always the right approach for someone who's using dreams and nightmares as a tool to support their emotional healing. And do you feel that there is regulation in this field, or is it too new to be looking at that?
So there's a lot of questions in that. Dream work has actually been with the practice of psychotherapy since its inception. Freud and Jung were, kind of the, first people to really invent a kind of psychotherapy practice that was very much centered on dreams. And so dream work used to have a much more central place than it does now. But there is also this, there's a way that, people who work in clinical practice, some of us have learned how to work with dreams in our university setting and clinical settings, and had a lot of training that way. And there's also a whole faction of people who work with dreams out of interest and passion. And, that's not necessarily a bad thing, but sometimes I think just, any powerful tool in the wrong hands can be dangerous. And that dreams they need to be taken seriously sometimes. And so just looking up in a book what your dream means and taking that seriously, I don't really advise. I actually am not a fan of dream dictionaries or,
Yes.
Kind of just standard answers. If you dream about a horse, it means this. If you dream about a dog, it means this. It's not really true. There are some universal themes, of course, that come up in everybody's life, and they'll be reflected in dreams, but everybody's dream world is as unique as their own inner world. And so for us to say that we could interpret their dream and tell them what it means without actually getting to know their own interior world and what those images are meaning specifically to them is really, I think, misguided. I feel like, so you could look at a book of dream symbols and you could go through and say, oh, which ones resonate? Maybe there's something that catches you, that gets your attention and or you get a visceral response to. Then you would say, yeah, that particular interpretation of this image probably has something to say to me, but you can't take it as gospel. I feel like a much more appropriate way to work with dreams is to work with them individually, and some people will even develop their own symbol dictionary for their dream world, and so that their dream animals have a specific association. But even that isn't always true, because sometimes a dream dog can be your best and loyal friend, and sometimes it can be a vicious animal that wants to attack you. You can see how it can quickly become a problem if you try to attach a standard definition.
Yes, I think that was beautifully said, because this has been running in my mind, but I felt you were the perfect person to ask that question to, because it is a concerning area at times when you see a lot of people doing this, talking about, oh, you had a dream about water, it means this, or if you had a dream about you're flying as a bird, it means something else. And I truly believe the feeling sometimes is very different to, as you said, a dog could be fear, a dog could be just feelings of love. I mean, that's such a world of difference. But coming back to nightmares, how do nightmares actually relate to sleep itself?
So one of the standard definitions of nightmares that they've used for research is that nightmares are frightening dreams that are so intense they wake you up. Now, this isn't always applied, because sometimes people will say any very scary or really dark and disturbing dream is a nightmare. But a lot of times they'll use this awakening criteria. And it's true that nightmares can really disrupt sleep. And so they can be of quite a large concern if this happens frequently. So to be considered, a problem psychologically or clinically, someone would have to have nightmares at, say, 3 times a week or more. And you can see how if your sleep is disturbed more than half the time, that it's going to start to affect your day-to-day functioning. It's going to affect your mood, and it's a problem that really needs attention. And the really interesting thing I find about nightmares, because I've made it a real focus in my communications with potential clinicians or with people who have nightmares, is that they really are treatable. There's really a lot you can do to reduce how disturbing they feel, to reduce their frequency. And a lot of people are not aware of that. It's been well studied. And I think maybe in a study of college students, they found that maybe 1 in 10 who had really frequent nightmares would actually talk to someone about it and tell a professional that they were experiencing this. I mean, partly because they think, oh, doesn't everybody have nightmares? Or they think it might be normal, or they feel like even if they did say something, there's nothing that you can do about it, or they would be considered people might look at their dream content and see them as disturbed themselves. They would see, they're worried that their dream content would be a reflection on them, when it really is not. I mean, it can be a reflection on the kinds of things you've experienced. If you've had trauma in your background or childhood adversity, you're way more prone to nightmares. If you have anxiety, or you're way more prone to them. It doesn't make you any sort of bad person per se, but it means that your dreams are showing that there's something amiss that needs attention, and you can really get help. That's something I would love for to be more widely known, is that nightmares are so treatable.
So is nightmares, you mentioned repetitive, but sometimes, Leslie, I've had a very traumatic 7-8 year period about 15 to 20 years ago. And, you know, while I don't have repetitive nightmares, they do show up as random nightmares where I wake up and then I recall a very specific incident that occurred in that period. And then I am left with the racing heart and the increased pulse and feeling like I'm sweating, a little disoriented at times. And this happened just a few days ago where I had a nightmare where I was traveling somewhere and I didn't have money and I didn't reach that place. And I woke up and remembered this very specific incident in that period of time where I didn't have money to reach somewhere and I requested someone to come and collect me and he didn't show up. And then the fear of searching in the dark for somebody to take me back home from the airport and whether I'll reach home safe, reaching home to find this person there threatening me and telling me I purposely wanted you to experience it as punishment for something. You know, that's still 15 years later, I still woke up and I felt very shaken by it. Well, it's not repetitive. What I want to ask you is that it's powerful enough for people to see those ripples of impact from trauma for several decades later. So even if it's not repetitive, do we still count it as nightmares, and would we still be able to do whatever you would advise us to do later in the episode to help us move past that space?
Yes, absolutely. It doesn't have to be repetitive to be considered a nightmare. And it's just that the most troublesome ones seem to be about a specific incident or period of trauma in someone's life that they haven't fully recovered from, and that those dreams will repeat, or the theme will repeat, and it doesn't feel like they can get past it. But they can also be like you described. They can be about a traumatic event that kind of for some reason is still held in your body in some way. I think it's you know, sort of held in our nervous system, and when something happens that reawakens it, then we'll dream about it or we'll feel it, and it's still not completely resolved in your body, and so your dream will bring it back. And I think it's our dreams attempt to, you know, you think about it in terms of a therapy process, the way that you would resolve this is to talk about it, but in a way where you're feeling supported, so that you have this experience of talking about and revisiting something that's really frightening, but in a context of something, in a place that's safe, where you have, say, me as your therapist to tell you it's okay, you can just tell me about it, and I can remind you that you're safe, and you can find you know, first of all, some calm in your body so that you can talk about it. And the memory then gets paired with this new experience of it where you're supported and you're walking through it, in your body can kind of settle. And what happens, I think, with people's, you know, who have a traumatic event that never really got all the way metabolized and settled, is it can return when we're reminded of something like it, or in times of extreme stress, or, you know, it just seems like the sort of the body knows this isn't completely been resolved yet, but I'm going to give it another try. And so, you know, with a dream like that, I would say talking about it can be really helpful, because already you can feel how telling me and me saying, oh, it's okay, it's probably something that awakened it again, and that you know, there's a way I can say something soothing, or find what I would typically do is walk through the dream with someone and find places in the dream that felt soothing or helpful, or ways that you can kind of find resources either in your own body or in the dream, and then allow it to play forward. This is the really universal approach to nightmare treatment now, is to let the dream play forward. And I find that if you're allow it to play forward from a calm place where you feel safe, the dream will find its resolution. And once you've done that, surprisingly, the dream isn't the same again. It's amazing. I mean, it might take a few iterations if it's something that's really been held for a long time, or is, say, still an active grieving process, or an active trauma recovery process. It's not like an instant fix necessarily, but the dream itself seems to respond to allowing it to play forward, because you notice you tend to wake up in your nightmare kind of right in the scariest place where your body's charged up. And so if you let it play forward, then I think that experience of it carrying on to a place that feels okay gets remembered. And then when you have that dream again, it doesn't wake you up in this charged place. It might just carry on like any other dream. You might not even remember it because the dream has completed and you've kept sleeping. And so it will feel like you're not having that dream anymore. And sometimes it will come back, but it will have some changes. Like when you've dreamed it forward, it might incorporate some of those things. It's really amazing to me how powerful this very simple way of letting the dream carry on can help so much. So I'm describing it quite specifically so people can hear that, and you as well. And I noticed, because I did a study on this with refugees for my doctoral thesis, I had it's a very small group of refugees that had very, their nightmares were basically their biggest complaint, and they had recurrent nightmares and PTSD, and coupled with a lot of depression. And when I trained other therapists to like allow them to just dream their dream forward, and their dreams all shifted. Sometimes they stopped completely, their nightmares stopped. But what I noticed also is that when they didn't, they felt like they had a tool they could use. If they woke up in the night with a nightmare, they didn't feel like they were a victim of it anymore. But they did, this one person in particular, I'm thinking, described it as having some control over the dream versus feeling like the dream had control over him. And he would just imagine it forward to somewhere different, and he wouldn't feel afraid to go back to sleep. Whereas, sometimes people who have these recurrent nightmares will just wake up and then they won't want to go back to sleep because they'll be worried about going right back into the same dream. But just calming down and imagining it forward, very often they go back to sleep and the dream doesn't come and plague them again. And so it's something that people, I noticed, spontaneously started taking home with them and doing when they woke up in the night with nightmares, just to let it carry forward and imagine something different.
And I think you described that beautifully. And I do want to ask you, because of my own experience, how trauma is linked to nightmares. And there's two aspects to this. First of all, just how does that impact? Does that mean that nightmares do occur post very traumatic episodes due to a lack of feeling of safety, and the other aspect of this is, I know you mentioned that, if we're in a calm place and we tell someone, but let's say I'm out of that situation today, even though the ripples are still coming to me occasionally in the form of nightmares, but 8 years for me was a very long period, and I did have a lot of nightmares while in the situation. And I just want to know, what does that mean if someone is still in the situation that's contributing to the trauma, that it's more challenging? Is it impossible for them to deal with the nightmares if they're not removed from the situation?
Yes, really good questions. Yeah, important questions. So what I think is going on, that the idea of safety is so important, because one of the things I just did, I spent a couple years working on a paper where I'm looking at the nervous system and its impact on our dreams and nightmares. And I've been looking at something called the polyvagal theory, which was developed by Stephen Porges, and it's been applied a lot to trauma therapy, and the idea that when our nervous system feels safe, then we can engage socially. We're able to really take the benefits of therapy, and really our bodies can rest and relax, and that's supposed to be our normal state. But when we've been exposed to trauma, our nervous system can shift into a fight-flight response, an activated response, and back out again. That would be a normal, getting ready to respond to the threat. But when people have repeated trauma, what will happen is their body can kind of get locked into this feeling of unsafe, or it can go to the next step, which is more of an immobility response, where they collapse and get dissociative. And so depending on how old you were when the trauma happened, it seems like if you have a lot of adversity and trauma in very early years, your nervous system can kind of get locked into a state where it doesn't feel safe and can easily slip into those responses. It's a conditioned response. And so there's this way that if you're in a situation in your life where you're not safe, truly not safe, it makes sense that your body is going to feel this hyper alert or this dissociative state to keep you ready, or to keep you sort of at a distance from the trauma so that you can manage it. And when you're actively in that kind of a situation, it's very difficult to recover, because you don't get a chance. You don't get into this resting, safe place where you can take advantage of the help that other people would offer, or your nervous system can settle and rest and heal. So when you're in the midst of it, whether it's other ways of responding to trauma or nightmares or both, you're getting a warning system from your body, a signal that something's wrong. But the very first thing you would do in any kind of trauma work, whether it's with nightmares or not, is removing the danger, if at all possible, because until you do that, how is your body going to settle? It won't. It will know better. You can't tell it it's safe when it's not. So really, it's tough to work with trauma when people are in the midst of it. And I was looking at, for my study, working with first responders, for example, because they experience a lot of trauma. And but I couldn't really work with somebody and do a study and see how it was impacting them, because every day they go to work, they could potentially be exposed to another trauma, a traumatic situation that would activate their nervous system. So it wouldn't be very easy to measure whether it was working or not. So I worked with people who were refugees who successfully, moved to Canada from wherever they were in the world that was dangerous. So they were no longer physically in the same kind of danger. I mean, they still had stressful lives, for sure, establishing themselves in a new country and being far from home, but at least that sort of the deeply threatening danger was no longer present. So the healing was possible. And so, yeah, it's a tough answer, really, to say that when you're in the midst of trauma, it's really hard to recover. And, the first order of the day is actually to try and find a way to create more safety. Yeah.
Yes, I think that's so important. And we see that even in the physiological space, Leslie, where no matter what someone is doing in terms of great food, nutrients, exercise, if they're still in that situation, it becomes almost impossible to move past any symptoms, because they're perpetually in that fight or flight. But tell us a little bit about I've heard in some of the dream episodes people talking about sleep paralysis, and is there an area where it gets confused with nightmares, or how is it different? How is it similar?
Yes, it's often mistaken for a nightmare, but it's actually quite a different phenomenon. One of the things that is a really easy distinguishing factor is that your sleep paralysis episodes happen during your deep sleep or in transition from wake to sleep, and sort of in the second half of the night. That's mostly when you have your nightmares during REM sleep, when we're we're more prone to dreaming. But what happens when we're dreaming is that our body is put into a state of paralysis every night. Everybody goes into sleep paralysis. So it's actually a normal thing. And I don't know, there's a lot of people that aren't aware of it, but it's our body's way of protecting us from thrashing around and acting out our dreams. And I mean, there are a few people who have conditions where this sleep paralysis doesn't come, or this, the healthy paralysis doesn't happen and they move around. But normally we're supposed to be frozen. And then we'll, as we come out of our dreaming sleep, the paralysis is meant to wear off before we wake up. But sometimes we wake up before the paralysis sets in, or we wake up during that transition. And so we'll be awake, but our body will still be in that paralysis state. And it's often accompanied by like a weight in the chest. It can people experience presences and really kind of an evil, sort of frightening sort of mood. It's a really scary experience. I think partly because what happens if you wake up and you're paralyzed is you get flooded with fear. And then when you're afraid, what you see is scary. I think some of it is state dependent. And so what I tell people who have this experience, and it happens more often if your sleep is disturbed, or if you're shift work or students, it's fairly common if you're students or, studying a lot, or just having just a disrupted sleep schedule and you're really tired, is that it's really normal. It's not like something to be alarmed about. And it usually passes very quickly. So if you wait it out, even just a minute or two, just breathing and calming yourself down and going, no, this is normal. I'm just, still just coming out of a dream, and you trying to basically fully wake yourself up. It will pass. And sometimes you can also, if you're interested in lucid dreaming, you're kind of in this paradoxical state where you're still kind of in a dream state and kind of awake. So if you want to try imagining that, you go back into your dream world, some people use this sleep paralysis episodes as an entry into lucid dreaming, but mostly people are just quite frightened by it. And so I'm just say, it's actually not a worry. And if you just wait and kind of get interested and curious, that helps dispel the fear, and very quickly you'll wake up out of it.
So finally, what can we actually do about nightmares? And again, I want to ask you this in two ways. The first, of course, is if someone is having repetitive nightmares and they had very traumatic episodes, then as a way to move past, obviously, I think this is a long journey with that. But also in terms of someone like me, where it's just popping up in episodes here and there, I know that the rest of the time that I'm probably a pretty relaxed person, but at that time I do feel as if I'm defeated again, as if I'm weighed down again, and suddenly I feel I can't work. I'm kind of, as you described it before, frozen. All my faculties seem to leave me for a half a day until, as you mentioned yesterday, I spoke to my husband about it, and he kind of gave me a hug and he said, but you're not in that situation anymore. And then a few hours later, I was back to normal. But in that space of the night, it was chilling, it was scary again. So what can we do right there when it's happening to us? And also if someone is having these repetitive nightmares.
Yeah, so we're all gonna have nightmares sometimes. I think that they're fairly normal. So having the occasional nightmare is not a concern. And I think that, there can be various reasons why they crop up, like just, feeling particularly stressed, or having some reminder of a traumatic incident that then plays in your dreams. Those are pretty typical. And I think what you did is actually really lovely. I really feel like it's important to tell people your nightmares, just to share them, because then you don't feel so alone with them. And there's a way that we automatically, as human beings, we help each other regulate and calm down by not being, alone with it. And so telling your husband and getting reassurance and a hug, that's something I would absolutely recommend. Maybe you don't want to wake him up in the middle of the night. So if you are woken up in the middle of the night,
I actually did want to wake him up, and I refrained from doing it. And I even told him later in the day, I wanted to wake you up and get a hug at that moment. And he said, but you should have. What was wrong?
Mm-hmm. Yeah. So if you have that option and your partner doesn't mind, that's a nice thing to do, and what he told you is also useful, just to remind yourself, okay, look around the room, recognize where you are, really notice that you're safe, and this is of course assuming you are safe, and that's important. And to just notice, I'm in a safe environment. And you can do things like, there's certain breathing exercises that will calm your nervous system. If you have a longer exhale than an inhale, for example, your parasympathetic nervous system will start to calm you down. And so starting just at a physiological level to calm down, because you wake up out of a nightmare in this activated state, and you don't want to go back to sleep before your system has calmed down, because otherwise you're more likely to go back into that kind of a dream again. So calming down and then imagining your dream forward, like I described, you can go to where the place where the dream might have, taken a turn for the worse, or right at the end, and just imagine it forward to, it can be completely imaginal. It can be something, you can interject something really crazy and wild, and then it will be a memorable thing. Sometimes, when I'm working with traumatic memories, and knowing that you can actually affect memories by introducing new elements into it. And in memories that are really bad, changing them isn't such a terrible thing. It's not like we're trying to mess with reality or say it didn't happen, but we're just trying to interject something into that memory, so that whenever you have that memory, it comes with this other piece you've added. So you can develop superpowers, or and bring some humorous element into it. It's kind of, you can be playful with it, but what you're doing is you're messing with the memory, and you're messing with the dream, so that it has pieces of it that are no longer scary. And you can remind yourself, of course, that it's happened in the past, because when we dream about a trauma and we're in the dream, it does feel so present and so real and immediate. And so just bringing in elements from your current life into the dream, into the current place and the current time, will really help create the dream turn it into more of a memory than a living experience in your body. And that is actually what dreaming does a lot. It weaves in, current elements into the past, so they become more distributed and easier to manage emotionally. That's what our dreams do with our memories. And so when they get stuck, like the other kind of dreams you're talking about, it's as if there's a constant present experience of that traumatic memory. It doesn't get filed into the memory banks. It stays in the body as this current experience that keeps happening. And these dreams are more of a worry, because they indicate that someone hasn't recovered from their trauma. That's a classic symptom of post-traumatic stress injury, if they have not really been able to assimilate this event to the point where it becomes a bad memory, as opposed to something that their body will occasionally experience right in the present. So that kind of is like a nightmare, is kind of like a flashback that happens at night, when, during the day, someone who has a post-traumatic stress injury will sometimes be overtaken by the fear as if it were happening now. And the nightmares are similar in that their dreams will be very like the experience that they had that was really, really traumatizing. And so you kind of work with the dreams in a similar way. It really shows that the trauma is not metabolized, and it needs, I would say you need, to work with that with a therapist who knows how to work with trauma. If it's really serious and you have these dreams recurrent repeatedly, there's a very established link between suicide risk and very frequent nightmares. So it's not something to take lightly. So in those cases, it's not, you can definitely do these things that I've suggested to help yourself, but you should also talk to someone. In those cases, that's not really something that it doesn't tend to get better all by itself, or not necessarily very quickly. I know I looked at this very interesting study that I've written about trauma survivors who'd been in the Holocaust, who'd been at Auschwitz, and a Polish researcher had looked at their dreams and found that even in that extremely traumatic situation, that their dreams did indicate and help them recover. And so it's not as if there's no hope. It's just that if you turn away from them and do nothing, they will keep coming back. They'll keep telling you this needs attention. So I think of them as attention getting, and a way to say, look, pay attention to this. And if you don't, I'll just keep coming back until you are able to do something. I think one of the features of post-traumatic stress injury is this tendency to avoid. Of course, if it's a terrible memory and a painful period, you don't want to necessarily look at it. But I guess that, if you have those dreams, they're telling you you need to put this behind you. You need to metabolize it to the point where your body knows that you're now safe and this is a memory. And so that kind of therapy needs to be done, and it doesn't feel bad. What feels bad is to continue in this same pattern. And so I think that, it can be a pleasant surprise, in fact, that when you work with the nightmares and with the trauma, that you feel better. I guess that's not a surprise. Ideally, that's what therapy of any kind does, is it makes you feel better. But there's a tendency to not want to go there because the material is frightening. And I'm saying, that talking to somebody about it is going to make it better than not. And if you don't, it kind of just stays frozen in time.
I'm just saying, honor them, and they could actually be the key to moving past that trauma itself, but provided that you find the right person to guide you through this process. And I think that's very, very important in this situation. In the case of nightmares, I would definitely advise people to look out for someone who's in clinical practice like yourself, versus just looking up meanings of dreams and nightmares, for sure. I know we're almost out of time, Leslie, but I would like us to quickly speak about children and nightmares, because is it different in children? Is it something that we take seriously? Is it something that they're just going through as their mind is evolving? Is the solution just to give them a hug and just cuddle them and let them fall back asleep?
So nightmares are far more common in children. So when kids are having frequent nightmares, it isn't necessarily the same level of concern. And it's a developmental process. And so through their years, especially say from about 4 or 5 up to about age 10 or so, they can go through periods of frequent nightmares. And you can do the same kinds of things with them, where you let them complete the nightmare and, maybe ask them to, give it a new ending, or have them acquire some kind of superpower, or make it a game where you help them imagine an ending or draw one, or talk to the monsters and make friends, or find a way so that they're willing to share and work with them, because having company, no matter what the age, is helpful. But also to know that children have more night terrors, more nightmares, and that it's they will usually just resolve themselves on their own. But after about age 10 or 11, if the nightmares are still frequent, that's kind of a turning point where they can become chronic. And so at that point, if there's a lot of nightmares and they're frequent, I would say that you might want to get some therapy, because it is also true that if someone has a lot of trauma in their childhood, that their nightmares can reflect that. So it's not as if every child who has frequent nightmares is going to grow out of them, because sometimes it's a reflection of the level of stress they're experiencing. And so I would pay attention to them, and generally, though, yes, it's in the normal course of events, but if it's also accompanied by a lot of other signs of anxiety or distress, it's a way, it's a window. I would say, one thing to do with your child is to develop a relationship with them where they're comfortable telling you their dreams, and see if, if they are really frequent, recurring, and they're accompanied by a lot of other, worrisome signs, then the person might need, professional help. But for the most part, they're normal. And so with those caveats, I would say, yeah, just be comforting and reassuring, and otherwise see if they will just kind of resolve themselves.
I loved what you said about, the superpowers, Leslie, because the next time I have these dreams that remind me of my traumatic experience, I'm going to picture myself as Captain Marvel and swoop out of there. That was beautiful. I mean, it's such a simple thing, but it just changes the feeling within us so powerfully. I think that can be great for kids. Any final words to share about nightmares and trauma before we conclude?
So one thing I would say is that we talked a lot about the really difficult side of trauma, dreaming, and there are a lot of especially frequent nightmare sufferers where it is related to adversity, and it needs attention. But I will also say that nightmares can be some of the most powerfully transformative, amazing dreams that we have, and that nightmares can be a sign of big changes, and sort of frightening to an aspect of ourselves that might be dying off. Say if we're ending a job or a relationship, or some aspect of our personality really needs to be left behind as we shift into something new, that can take the form of a nightmare. It can take the form of a death or something violent. And it's really a metaphor for some kind of transformation. So I don't want to give the impression that all nightmares are bad, because a lot of them are really amazingly transformative dreams that, if you pay attention to, will help you shift in ways that are extremely positive. I would say they're more like a metaphorical representation of big events, of things that are that can be like, sometimes a tornado or a great big, earth-shattering event can really just be a metaphor for some kind of major shift that's about to happen or is in the process of happening. It's like the idea that some parts of us need to die for new parts of us to be born, or there's a way that I think a lot of times when people are dreaming about intruders, say, for example, or parts of them dying, there might be a part of their ego that is really just needing to take a back seat, or to shift into some new phase of their life or their personal development. And it can feel like a nightmare because it's scary to the part of us that wants to still live on. And so it can describe a dynamic that's intrapersonal, that's very intense, but and feels scary, but it's maybe more of a dream about change. And so sometimes it's important to look at some of the nightmare material, especially that might have a lot of violence or gory images, and go, well, they're not always literal. They're very often metaphorical, and they may not be as bad as they seem. Very often they're not as bad as they seem.
I love that, Leslie. Where can people find you? And do you also work remotely if someone needed help, or do you only see clients in person?
I can be found, probably the simplest is my website, which is drleslieellis.com. That's all lowercase, DRLESLIEELLIS.com. And I don't see very many clients anymore. I'm mostly focused on teaching other clinicians how to work with nightmares. So probably the best thing to do is contact me if you are wanting to learn how to do this as a clinician. And because I only can see patients in my immediate area, because that's how our license works. But I also would say that I'm planning, and I haven't got it up yet, I'm planning to put a list of clinicians who had trained, because I've trained very many over the years who have experience in this particular way of treating nightmares. And so it's one of the things I'm going to do in the very near future is have a list of clinicians and they come from all over the world. So hopefully that can be a resource for people as well.
I think that's a beautiful resource. So I'm presuming at any point you will have that on your website. If someone were to access, that's perfect. Thank you, Dr. Ellis, for being here and sharing your wisdom. And I really think this was very important information, and you broke it apart so beautifully. And just that right balance of hand-holding, hope, knowledge, all of that interwoven together. Thank you for your time, and it was an absolute pleasure having you today.
Oh, I love talking to you as well. You have this very calming presence that's a perfect example of what I'm talking about. And I loved your questions, and I really enjoyed this interview. So thank you for having me here.
On this episode, we heard Dr. Ellis talk in depth about PTSD, trauma, nightmares, and sleep. We have dealt with dreams in 6 episodes before this, and you can scroll the linked episodes on this one if you missed any. Nightmares are a very specific subject which requires clinical guidance and care, such as with the expertise of someone like Dr. Leslie Ellis. I'd like to conclude this episode by sharing my perspectives on the powerful benefits of subtle practices such as guided meditations. Trauma and nightmares can trigger persistent fight-or-flight responses, where the ability to shift into a parasympathetic state can be very challenging. Find yourself a clinician who can help you navigate trauma recovery. In the meantime, set yourself up with my guided afternoon mindfulness on episode 128 or the prana for healing on episode 123 with Himalayan Yogi. Commit to a daily practice in the afternoon to break up your day. These are powerfully calming practices which, when done every day, can gently hold your hand and walk you towards recovery, working beautifully alongside any clinical care that you might need or that you might need to get. Have a wonderful day. Hi everyone, I hope you enjoyed the show today. Just a reminder that this podcast is for information purposes only. It is not a substitute for professional care by a doctor or otherwise qualified health professional. This information is provided on the understanding that it does not constitute medical or other professional advice or services. If you are looking for personal help on your health journey, do seek out a qualified professional. Please do make your own healthcare decisions based upon your research and in partnership with a qualified healthcare professional. It is in no way intended as medical advice or a treatment or cure for any condition. Be sure to always directly work with a qualified practitioner before making any changes to your diet or lifestyle that may feel out of your realm of comfort or understanding. If you are looking for an allied functional medicine practitioner, do seek out more information on www.phytothrive.com. It is important that you have someone who is qualified and understands your health personally in order to provide adequate care, especially when it comes to chronic health conditions. Be sure to subscribe to the Sleep Whisperer podcast on your favorite podcast app to get each episode as soon as it launches.